Hello and welcome to Venomcast. I am here once again with Dorothy Okemo in Nairobi, Kenya. And today we're here to talk about snakebite as a systemically neglected disease. So thank you so much for joining me again, Dorothy.
Thank you for having me, Chloe.
Today is World Neglected Tropical Disease Day. And so can you tell me a little bit about what exactly is a neglected tropical disease and how does snakebite fit that description?
That is a really good question, Chloe, and I think for purposes of being factual, I will use the WHO definition, which defines neglected tropical diseases as a diverse group of conditions caused by a variety of pathogens which include toxins and which are associated with devastating health and socio-economic consequences. Of course, neglected tropical diseases are prevalent among impoverished communities in tropical areas, and they are neglected because they are actually absent from the global health agenda, which is something that I can actually attest to. I mean, there has been a lot of clamor around universal health coverage, but interestingly, neglected tropical diseases still have very limited resources and are almost ignored by global funding agencies. Neglected tropical diseases are also affecting neglected populations, perpetuating the cycle of poverty, poor educational outcomes, and limited professional opportunities, hence increasing stigma and social exclusion. And so when you look at the definition of neglected tropical diseases, certainly snake bites squarely fit that description because snake bites occur in rural and marginalized areas. They, in 95% of the cases, affect the poor people living in those communities and living on less than $1 a day, obviously. And then without a doubt, even looking at the work we have done and the engagements we have been able to undertake, there is very little funding or prioritization for snake bites, even here in Kenya. Even when you look at the primary healthcare programs, there is really nothing to do with the issue of snake bite mitigation. And yet, the biggest strategy that is recommended to deal with the issue of snake bites is really community education and prevention. So no wonder then snake bites actually really squarely fall within the purview of neglected tropical diseases.
Yeah, so like you said, a lot of these snake bites are occurring in the most vulnerable sectors of society. And so how is this impacting their access to healthcare?
Yes, unfortunately, snake bites actually do occur in the most marginalized areas, impacting the most impoverished communities. And of course, when you look at it from that perspective, then you realize that these are communities that are living in areas where the roads are actually impassable, number one. There are no modes of transport for public transportation, that is the second part. The third part is that because of those infrastructural issues, then the health facilities are also very, very far away, which means that victims of snake bites living in those areas, in most instances, will not even be able to get to a health facility in good time because there is no transport, the roads are impassable, and the nearest health facility is really, really, really far away. And even the ones that are close do not have the capacity to treat or manage the snake bite cases, neither do they have antivenom for that purpose.
In your experience, are clinics and primary health centers prepared to handle these venomous snake bites whenever the patients are able to arrive?
Unfortunately, that is not the case. And I think one of the challenges we have identified is that in the medical curriculum, there's very little that is taught around care management and treatment of snake bites, which means that even the healthcare workers that we have in those local facilities have very limited knowledge in terms of treating snake bites, in terms of using antivenom, and there's a lot of fear even to use the antivenom itself. Some of them even have the antivenom stocked in the facility, but the antivenom ends up expiring because nobody is confident enough to use it. In terms of knowing how a venomous bite is supposed to look like, in terms of identifying the progression of the envenomation for a person that has been bitten by a snake. And so those challenges actually remain at the forefront of why snake bites continue to lead to catastrophic consequences, people losing their lives or even losing their limbs, which means more needs to be done to make sure that healthcare workers actually are knowledgeable on this topic. I mean, in some communities that we have visited, the community members have told us that the healthcare worker actually require them to carry the snake so that they can identify it and know how to treat it. And we all know how dangerous this can be. For a person who has been bitten by a snake, instead of rushing to the health facility to start hunting down the snake, killing it, finding a bag, carrying it and taking it to the hospital, So yes, I think there's a lot that needs to be done in terms of preparedness and in terms of building the capacity of healthcare workers.
In snakebite, I think a lot of people hyper-focus on antivenoms, but there's a lot more required to treat a patient whenever they arrive. So besides antivenom, what other types of equipment or drugs would a physician or a medical facility need to treat a snakebite patient?
Wow, Chloe, that is quite an insightful question because you're absolutely correct. Many people wrongfully imagine that for snake bites, the only commodity you need is antivenom, but you're very right. There are many other commodities that are needed. I think the list of commodities is up to 50 commodities. For example, when you're bitten by a snake, whether venomous or not, usually the patient experiences a lot of pain, which means that we need to have, painkillers to be able to effectively do pain management for persons bitten by snakes. In some instances, those patients can actually be susceptible to tetanus, either through the bite or through some of the traditional methods that are used. And so having an anti-tetanus available is also very critical to treat a snakebite patient. Some of the really bad consequences of venomous bites include bleeding from every part or pore of the victim's body, and so it's important to have blood products to facilitate transfusion. Of course, some patients go into shock, so of course we need adrenaline. So there's a big list of commodities that are actually required to treat snake bites in addition to antivenom. And I think as we move forward, it's important for us in the work that we are doing to actually make this knowledge known to health workers, especially in the lower level facilities, in the level 3 facilities, so that they know the range of commodities that they should have available and that they can use to actually mitigate some of the effects and consequences of snake bites, even if at the end of the day they will need to do a referral for that patient. At least they'll be able to manage some of the symptoms that could have led to, death or disability.
Right now in Kenya, if a snakebite patient shows up to a clinic or a hospital, how much can they expect to pay for the treatment that they receive?
The cost of treatment of snake bites still remains very, very high. So, for example, in the public health facility, one vial of antivenom is just about 6,000 Kenya shillings. That is one vial.
For those of you who aren't familiar with Kenyan shillings, that's about $50 US.
And we all know that for certain snake bites, you might actually need even in excess of 5 to 6 vials to effectively counter the venom as a result of the snake bite. So what I'm saying is that treating snake bites, particularly for people who are not on any health insurance, is actually very expensive. I mean, we have gone to communities where people have had to sell their land, they have had to sell, any property they had just to be able to treat their relative or their family member that was bitten by a snake bite. So it's very expensive. But I think what makes it even more expensive is that in many cases in the public health facilities, the antivenom is usually either unavailable or stocked out. And so, of course, the people who brought their patient are then redirected to go to the public facility or pharmacy to buy the antivenom and bring it so that their patient can be treated. In the private sector, the antivenom is actually double the amount in the public sector. So it's about 12,000 Kenya shillings, which means that we are really increasing the gap for access to quality healthcare for victims of snakebite by really not making antivenom accessible or making it freely available in the public health facilities, and of course ensuring that these people are covered on the National Health Insurance Scheme that then can be able to take care of these costs.
If snake bites were prioritized by the Kenyan government, what would the ideal policy on snake bites look like?
Yeah, I think we have made a number of policy recommendations around this. And so the ideal government initiative that would help to reduce the burden of snake bites would mean that, number one, we are introducing a specific curriculum in the Kenya Medical Training Institute on how to treat and manage snake bites, so that all the doctors or interns or clinical officers that are then being posted in the public health facilities actually have the requisite knowledge. So that is number one. Number two is ensuring that all the level 3 health facilities, which are the ones that are usually closest to the community members, actually have antivenom stocked, and those that need cold chain actually have refrigeration provided for that. Number 3 is really enhancing the referral pathway so that there's a lot of consultation that can even happen virtually in those instances that the health facilities are still very far, irrespective of whether they're level 3, level 4, or level 5, so that there's professional guidance that can be provided to a doctor in the remotest part of Turkana, for example, to be able to effectively manage the snake bite case. And of course, the other one is really making the snake bite commodities free of charge, particularly in the rural and remote areas of Kenya. Last but not least, the government, both at national and county level, need to actually put in a budget line, put in resources, and have a specific policy on what their strategy is in terms of mitigating snake bites, in terms of empowering communities, in terms of providing treatment, and in terms of helping community members, particularly those who are not able to afford, to actually address some of the determinants of health that actually make it worse for them in terms of the consequences they face due to snake bites.
Can you tell me a little bit about the Access to Medicines platform and what you're doing in terms of snakebite?
Access to Medicines platform is a local non-governmental organization that works in Kenya, particularly in the rural and hard-to-reach areas, on the issue of neglected tropical diseases and other health priority areas. But for today's podcast, we will just speak about our work on NTDs. And our focus when it comes to neglected tropical diseases is really on the issue of snake bites. So really trying to understand what the burden of snake bite is, which means that we have had to do a lot of research to understand the scale and the scope of snake bite incidences in Kenya, to identify where these snakebite incidences occur very often, and then to also go to the ground and find out from the community what they actually know about snakes and snake bites, if they have any strategies of how to prevent or even provide any first aid when they are bitten by snakes. And of course, that kind of intervention is not complete until we look at it from a policy perspective. So really having interactions and engagement with policy and decision makers to understand what are they doing in terms of managing and caring for snakebite patients. What kind of policies and plans do they have on the ground? How prepared are the health facilities in those local areas? And how well informed are the healthcare workers in terms of dealing with a snakebite case? So generally, that is what we have done at that level. And of course, we have not just asked those questions, we have gone down further to actually support and implement some of the strategies that are recommended. That, of course, includes community engagement and educating community members on the recommended prevention measures. Of course, enhancing this through the Snakebite School program, where we have developed very innovative information education materials for school children. Specifically, we have developed a comic book on snakebite prevention, which we called Safia's 8 Secrets, and we have gone further to translate this book into Swahili. As you know, Swahili is Kenya's national language, which means that any child from any school, from anywhere, is able to actually read the book in Swahili. So we are making it accessible to every child in this country. We have also gone further to train healthcare workers on care management and treatment of snake bites in about 9 counties, and how to effectively use antivenom. And of course, because these snakebite incidences happen at community level, we have also sensitized community health promoters, who are really the healthcare workers at level 1 and have the largest reach in terms of reaching households with prevention messaging. So in a nutshell, that is what we have done, and that's what we continue to do at Access to Medicine's platform in terms of the snakebite program, of course with general support from Health Action International.
Wow, that is quite an impressive list of projects you have going on. And I'm excited to see how this changes the landscape of snakebite in rural areas. Thank you so much, Dorothy, for telling me about this current situation in Kenya, the neglect that's happening, and thank you for all of your incredible work that you're doing to address this situation.
Thank you so much, Chloe, for giving us this platform to be able to talk about this health issue that nobody is really working on, that nobody is really prioritizing. But for us, it is really important to our hearts, because all the work we do is really for the community, to make sure that they have equal access and equal rights, and they are healthy and their well-being is guaranteed like everybody else. So thank you for this.